Hello, welcome to Pediatric Pulse. Today we are diving into an essential topic for anyone involved in pediatric care on bronchodilators and their pediatric doses. Bronchodilators are crucial medications used to relieve bronchospasms in various respiratory conditions such as asthma. Understanding the correct dosages and administration methods is vital for ensuring the safety and effectiveness of these medications in children. For types of bronchodilators, we have beta-2 agonists, which are divided into two. We have the short-acting beta-2 agonist and the long-acting beta-2 agonist. For the short-acting beta-2 agonist, we have albuterol, which is also commonly known as salbutamol. For salbutamol, it has beta-2 agonist effects in patients with asthma. Its dosages are 2.5 to 5 milligrams inhalation nebulizer solution every 20 to 30 minutes or when required. It is used for moderate, severe, or life-threatening asthma. Another dose is 2 to 10 puffs of inhalation aerosol, which is repeated every 10 to 20 minutes or when necessary. It is used for moderate and severe acute asthma. And for salbutamol infusion, we use a dose of 1 to 2 micrograms per kg per minute. For salbutamol injection, we administer 5 micrograms per kg over 5 minutes for children between 1 to 23 months. And for a child between 2 to 17 years, we administer 15 micrograms per kg at a maximum dose of 250 micrograms per dose, which is to be administered over 5 minutes. Remember, administration of salbutamol IV, there is increased risk of bronchospasms. Also remember to use it with caution in patients with cardiovascular diseases, for example, arrhythmias, coronary insufficiency, among others. For the long-acting beta-2 agonist, we have an example which is salmeterol, which is used as an inhaler. We have another class of drugs, the anticholinergics. They are divided into two. We have the short-acting anticholinergics, for example, the ipratropium, and the long-acting anticholinergics, an example is the tiotropium. We start with the ipratropium bromide. Ipratropium bromide blocks the acetylcholine's bronchoconstrictive effects. We use it as an inhaler. For example, in children below 5 years, we use 2 inhalations which are equal to 34 micrograms every 20 minutes for 1 hour if necessary. And for children between 5 to 12 years, we use 4 to 8 inhalations every 20 minutes or as needed up to 3 hours to a maximum dose of 12 inhalations per day. During nebulization with the ipratropium bromide, for children below 5 years, we use a dose of 0.25 milligrams, which is equals to 250 micrograms every 20 minutes for 1 hour if necessary. And for children between 5 to 12 years, we use a dose of 250 to 500 micrograms every 6 hours. Remember, there is increased risk of paradoxical bronchospasms, dizziness, and blurred vision. Also remember to use it with caution in patients with narrow angle glaucoma. Another class of drugs that we have is the methylxanthines. An example is theophylline. So for aminophylline, it inhibits phosphodiesterase 4, causing bronchodilation. For the loading dose, for a child who has not been previously on theophylline, we administer a dose of 5 to 6 milligrams per kg IV over 20 to 30 minutes. And for a child who has been previously on theophylline, we administer 2 to 3 milligrams per kg IV based on the serum levels. For the maintenance dose of aminophylline infusion, for children between 6 weeks to 6 months, we use a dose of 0.5 milligrams per kg per hour. And for children between 6 months to 12 months, we use 0.6 to 0.7 milligrams per kg per hour. Remember, with the use of aminophylline IV, there is increased risk of extravasation. Also use it with caution in patients with hepatic impairment, seizure disorders, and cardiac arrhythmias, including bradyarrhythmias. Still on aminophylline maintenance infusion dose, for children between 1 to 9 years, we use a dose of 1 to 1.2 milligrams per kg per hour. And for children between 9 to 12 years, we use 0.9 milligrams per kg per hour. Remember to check out on side effects such as tachycardia, palpitation, dry mouth, and tremors. Thank you for watching. See you in the next video.